catalog here belongs to OOU, in which Dr. Sekinat is leading. So this is the link to our FDP. Has about three different data sets. So I just contain daily cases of COVID-19, cases by state in Nigeria, cases by geographical zones. Nigeria has 6 geopolitical zones. And so therefore, we have a data set for COVID-19 for each geographical zone. Then we also have data for COVID-19 laboratories and other COVID-19 related infodemic and misinformation in Nigeria. So this 4 data set is an Excel file, and it has 6 different worksheets. So the first sheet, we call it our daily cases. And this comprises daily cases of COVID-19 in Nigeria as reported by Nigeria Center for Disease Control on Twitter. So we scrape their data on a daily basis in order to get this data set. Then we also have COVID-19 cases by state. Nigeria has 36 states, including FCT, which is Federal Capital Territory. So state in Nigeria is the same thing as provinces in other countries. So we also have cases by geopolitical zone, as I said before. Then the first sheet, in which I'm going to show you later, has cumulative confirmed cases per state. So this is on the daily cumulative confirmed cases for each state, the same thing as cumulative recovery cases per state, and also cumulative death cases per state. So here are the keywords for these data sets. So we call it COVID-19 daily update in Nigeria, coronavirus in Nigeria, COVID-19 by geopolitical zones in Nigeria. Okay, so this is how the workbook look like. See here, we have 6 different worksheets. And now this is how the first worksheet look like. And this is a daily cases of COVID-19 in Nigeria. So as of yesterday, Nigeria has 55,116 confirmed cases. And the daily death is, as of yesterday, Nigeria has only 4 deaths. Then this is the second worksheet. So this shows the COVID-19 cases per state. As I said before, Nigeria has 36 states or provinces, and these are different data sets that we have. We have discharge rate, fatality rate, number of deaths, and also for geopolitical zone, Nigeria has 6 geopolitical zones, and these are the distribution of the COVID-19. This is confirmed cases. This is number of COVID-19 patients on admission, number of recovered cases, number of we also have deaths, which I'm not showing here. So this one shows daily cumulative confirmed cases per state. So on a daily basis for each state, we have the data in this sheet. And for this one, we have daily cumulative recovery cases per state. How patients recover from each state. And this is the daily cumulative death cases per state. Now, the second data set, we call it COVID-19 healthcare centers and some economic data in Nigeria. So this data has data on population by gender, COVID-19 cases per state, budget for each state, then total revenue available for each state in Nigeria, then some other healthcare facility per state. So these are the keywords for this data set. As you can see it here, we have state budget for 2019, initial 2020 budget per state in Nigeria before COVID-19, and then the revised 2020 budget per state. So this is how the data set look like. So here is a geocoordinate of each state, then the population estimate from 0 to 100 years in terms of gender. And this is the total population for each state. So continuation, so here we have the budget for each state. So this is the initial budget before COVID-19, and this is the revised budget due to COVID-19. And this is how the budget reduced. So we call this one reduction rate or percentage reduction. And here we have healthcare facility. So, and this data set has 3 levels. As you can see it here, we have primary, secondary, and tertiary healthcare facilities. And this is COVID-19 government laboratories. We see how this number of government laboratories in the other slide. So as you can see it here, these are the names of government laboratories for testing COVID-19. And this is the number that is available for each state in Nigeria. Also, the third data set, which we call infodemics of COVID-19 on social media in Nigeria. So this data set contains different messages that 3,000 people received during COVID-19. So these are the keywords for this data set. As you can see it here: misinformation of COVID-19, myth about COVID-19, coronavirus messages in Nigeria, COVID-19 infodemics and misinformation in Nigeria, and so on. So this is how the data set look like. This is just the sample of the data set. And this one has 3,000 different messages that people received for COVID-19. So I would like to give a chance to Dr. Sekinat to continue on catalog 2, which we call lockdown tweets of Nigeria.
Yes, thank you, Ezekiel, for the wonderful presentation. Good afternoon, House. I'm glad to be part of this presentation. And next slide, please. Ezekiel, next slide. Yeah, so the second catalog for data science Nigeria, as we are all aware, the FDP, you can have one catalog can host many data. So now, the first catalog belonging to Data Science Nigeria hosts about 3 data, and we are still expecting more. But this second one belongs to Olabisi Onabanjo University, Agoiwoye, Nigeria. We have one data set here already on the lockdown tweets of what Nigerians are saying, what they are tweeting during the lockdown for 2 weeks, starting on the 26th of March, 2020 to the 30th of March. Next slide, please. And for this slide, we have about 26,000 tweets or retweets or favorites or mention of people in Nigeria. And we also have a start time and also end time for this report. So we have created it on the FDP. This is the data set, and we can show when the data set, when it was issued and the last time it was modified. Next slide, please. So I will still be talking more on this. Now, go more into the CEDA. But for this lockdown and face mask, what we talked generally on it was what people were tweeting and what they were saying on the lockdown. And we have the theme here and the points to share. We also have the live share for the data set here. And the keywords are on coronavirus, COVID-19, face mask, lockdown, and some other related keywords. Next slide. Ezekiel, next slide. Okay, now I will quickly move down to CEDA creation, because we are aware that our data is not exactly a medical data, but however, it is very, very essential to this pandemic or any other future pandemic. So what we did was that we created a workspace there and created folder for related work belonging to Nigeria or belonging to a particular location. Then I also created a metadata template for data. I populated it and make it open view in the hope that I could quickly transport it or export it to the CRF wizard form. Then I publish the metadata. Next slide. So this is the example of what the data set look like. We have the date of collection and the time. Then we also have username, though at the end of the day, I'm going to remove this username because we also value data privacy. So we have the replies and the actual tweet. That's the text and actual tweet. Then we also have the tweet ID and the state where the tweet is coming from. That's at the end of the Excel sheet hosting this data. Next slide. So we created the CEDA form. Created an account on the CEDA platform. Next slide. So here on the CEDA platform, I created folder for Nigeria and try to create many folders for different data sets. So for now, the one that I've created is for Nigeria lockdown tweet. We can see, and it's already published. Then I was trying to populate the CEDA, the metadata. So so far we have populated 2, and my data steward will continue to populate, but so far so good. Next slide. So, and this is how we created the metadata, all the fields belonging to the Excel sheet that shown earlier. Like we have the date, the region, we created it, and I also try to put the characteristics of what we expect. And we also try to put it into caution. This red mark shows required. So if you put a required on a field while trying to populate, if you cannot get a value, then you cannot move ahead. And it's so difficult going back and making correction to your field. Next slide. So, and this is our population stage. We have started populating. So I was picking the data one by one to put them on the CEDA form. Next slide. So here we are, that we have created we have populated at least to an extent, hoping now to share or export to the CRF form. Next slide. So welcome to the CRF form wizard. Next slide, please. Next slide. So here we have tried to create for VODAN Nigeria here, and also tried to create a mock tweet data set on the CRF form. Next slide, please. Actually, for here, for the CRF template, what I've done so far is create a mock data set just to see if we can actually work around this CRF. But so far, the problem, or where I'm stuck now, is importing my CEDA data set here to this CRF template. But I hope that by the end of the week, I should be able to get my way around it. But for now, this our CRF template has our mock data sets. Oh, yeah, next slide. So this is what we have done so far. So you can move on to the next slide. So now, the gains, actually, our data set, they are not exactly a medical data set, but as data scientists, we have so many gains that we expect from these data sets, and hosting them on the verification of this data. One, we can build model to analyze this data, or we can also build a decision support system for the government or the healthcare system. When we analyze this data, we can also get hidden information or detect novel pattern from this data, past, present, and we can also forecast into the future. Like the daily cases of the data set that was shown earlier by Data Science Nigeria, we are already gathering and trying to analyze data right now with Data Science Nigeria people on how we can forecast using that data. We forecast into the future what the pandemic is likely to look like maybe we can build a policy around it. Then the data sets, those treat data sets, they are not exactly a medical data, but we can analyze them thematically or use a qualitative analysis for them so that we can try to manage misinformation and disinformation. Because the problem we have right now is in parallel with the pandemic, the misinformation and disinformation and the myths about this COVID-19. So for the success of even the verification of our data, we need to control misinformation and disinformation, that is, or the myths around COVID-19 and past or present or future pandemic. Next slide. Yeah. Okay, some of the challenges that I faced while working on this was trying to populate the CEDA template. It is so difficult. One, the tweet data set contains over 26,000 tweets. I don't know how I'm going to do it, putting them in, populating the CEDA form one by one. I don't know how long it's going to take me to do that, but I think that we should try and find a way around how we can import data of a certain format into the CEDA form, so that to avoid mistakes when you are trying to type your data one by one, then linking the data, the CEDA data that I'd already published, I find it difficult linking it to the CRF wizard form, and also the FDP too. And also, linking the CEDA data set, the CRF and the FDP. I want to link them together. I still find a missing link. So I hope that Miriam and Professor Miriam, that they have done something like that. We can talk about it after the this time out. Then how to correctly fill out the CRF form. I've already done that using the mock, but I want to put my live data there and see how it works. Then another thing is that with the CRF form, I saw there that you can import. So I tried all data formats that I could know, like the JSON format, XLS, .csv, .text, but it wasn't accepting it. So maybe you could enlighten me more on a particular format to use to be imported into the CRF format. Next slide.
And sorry, in addition, we also try XML format, but it's still not accepting it.
Yes, you're right. Next slide. Okay, Ezekiel, you can continue from here.
Okay, thank you so much, Dr. Sakinat. So in this place, we don't know what to put under these rights. References. So we know that for institutions, we should put data science Nigeria, but this is not accepting it in a plain form, in a plain text. So I don't know whether we are going to use some other code to be able to put it here. And also in this place here where we have team. So I try to link the data set to it, and that one still accepts it, but I don't know if it's the right thing we are doing. And for this, in the description of the FDP, so I'm thinking it will be okay if we can integrate maybe Markdown, as they always have it like in Stack Overflow. When you want to write a text, you can put it in the Markdown format, and that will make the text to show properly. Like this one now, as you can see it here, after as follows. I'm expecting this one, the next sentence, to start from the second line here, but it's still taking everything as in one line. Yeah, thank you so much.
Yes, thank you so much. That's all that we have for Nigeria today. Thank you.
And in case we need anything from our FDP.
I believe Bart had a question for Dr. Sakinat.
Yes, I had a question for Dr. Sakinat and possibly also for Dr. Ezekiel. Very good presentation. Thanks very much for your input. Good job. And also, I would say again, a widening, of the different elements that we're trying to record here on the different fair data points. I'm particularly interested in what you said about linking the CEDAR form or importing the CEDAR form into the CRF wizard app. And my question was, have you discussed this with Marek or with any of the other technical guys? Because I'm sure there must be most likely a smart way of doing it. I don't know the answer, but I'm sure that maybe one of the technical guys could help you there. Have you been in contact with any of the people either in the Czech Republic or here in Holland?
No, not directly, but I remember that during the workshop, the M4M workshop, I remember that when Professor Miriam of Tunisia, when she was making her presentation, I think she made mention of that, and somebody from my team asked the question, and they said that they are working around it, and also for local FDP creation. You know, we already had a local FDP creation in Nigeria, but we had to wait for the cloud presentation to be ready, because they said that importing from local to cloud, I don't think they have done it. So, but I might be wrong. I stand to be corrected.
Yeah. Well, what I can do, I can let's say signal this issue to Marek and his team in the Czech Republic. Ask him to take a look at it. I will copy you in, so that may speed up the process for you. I'm pretty sure that he may have one or two very good ideas in terms of how to do that. So after this call, I will write him a small message telling him this is one of the things that he should take a look at.
Okay, sir. I think that maybe I don't know. I can get all our questions, all the challenges. I can get them across to you. Maybe if you show all of them to him, and then they tell us how to go about all of them. How about that?
Yeah. Well, let him first give a general guidance, and then we can go. You can go directly with him into more detail. And
Thank you, sir.
I will copy in also Miriam of Tunisia, so that she is aware of it, because she was also looking at the combination of CEDAR and the wizard. And it's interesting to see, you know, how these two can work together to create data. Sometimes, you know, you start with the template of CEDAR, sometimes it's the other way around, but it should be good if both can be used.
Okay. Yeah, thank you. We love that.
Thank you. Excellent, excellent presentation.
Okay.
Sorry, Charles, if I may,
Yeah.
before Frederick's question, one of the constraints that the Nigerian team has mentioned and which we have all identified is how to do a bulk import of data in a certain format into the FDPs. And I remember, I think Marek had, yes, addressed that it is not possible and it was not part of the requirement. And I know that Robert is also looking at, okay, probably they will have to look into that and work on that. But while that is ongoing, Marek also suggested that if the programmer can create a script and he provided the API of the CRF wizard, so this may be a good opportunity to challenge the programmers among us to see if they can write a script, since they have the API of the DSW, to automatically kind of do a bulk import. I just want to add that it has already been established that the bulk importing of data is not possible for now, and it's not been planned, at least not in the nearest future. So, but they have provided a way out by providing the API for the DSW and then giving the opportunity for us to work with the programmers to write a script that can at least import data, bulk data.
Yeah, I think that's an excellent idea. I've seen that message from Marek also. And yes, in terms of a real bulk input functionality, we still have to discuss that, because he is right, that was not in the specifications, that was not in the requirements. So we didn't ask him to actually build that, but you know, it's definitely one of the things that we want to do in next versions. So hopefully soon we will have that built into the product, but at this moment it is not. So yes, to use the, let's say, all the different data sciences here on this call to possibly write 1 or 2 scripts would be excellent, because then we could bypass the fact that we do not have it really as a functional block yet.
Yeah, I think the bet I will also share with Oluwole, who is a programmer, and let's see if within also we can find people who could solve that problem, even if it is temporarily until it becomes integrated into part of the steward.
Yeah. If you could look at that, and maybe look at the best people who could let's say test out one of these scripts, that would be excellent.
That's an excellent idea. Thank you, Prof.
All right, I can see another question from Frederick from the Kenya team, asking mainly about the data. So how many people in Nigeria do you believe can access Twitter, and how did your team choose Twitter beside communications from other Nigerian government processes or other communications from the Nigerian government?
Yes, thank you. Actually, everybody in Nigeria have access to Twitter account. You can create an account, you can tweet, you can retweet, you can mention, you can do all sorts of functions on Twitter. So everybody have access to Twitter accounts in Nigeria. And also, we also have access to get the tweets if we want, based on geolocation and based on certain keywords that you put there, or some other measures that you wish. But Nigeria have access to that. Now, maybe talking about choosing Twitter account besides other Nigerian processes. With COVID-19, there's been a kind of a closed up with clinical data. So we are still trying to find our way around it, because as data scientists, we need such data to prepare for future pandemic, though we don't pray for that. But besides that, there is no problem with using a Twitter or other social media account to get information on COVID-19, because even Nigeria NCDC, the National Center for Disease Control in Nigeria, puts their daily cases, their daily confirmed, recovered, and dead cases on Twitter accounts and on Telegram. So I see them almost every day. So scientists or programmers also scrape such information and gather them together, just like Data Science Nigeria did. So I hope I've answered that question. Or Ezekiel, would you like to make a contribution to that?
Yeah, exactly. So this is how we scrape data on Twitter from using NCDC handle, as you can see it here. So as of yesterday, this is what they posted or tweeted, and that is how we scrape it automatically. And any data from there will come here.
So major decisions or major bodies like even JAMB, WAEC, they all have Twitter handles, and they respond to people's question or clarify so many problems that people could have. So Twitter account is a good place to get information on any pressing issues.
And where we are doing it better than NCDC is that even on their website here, you will see that they don't have any daily cases of coronavirus here. So they only have it per state in Nigeria or provinces. So as you can see, there is nowhere you can get the daily update of coronavirus. And this is how we are helping NCDC to get it right. So for this one now, we can do any modeling, any time series model on this. So using maybe total cases or daily cases or daily recovery or daily death.
So this also transformed to most of the researches on forecasts for COVID-19. Most of the researchers or papers that we see around is based on total cases because it's difficult getting these daily cases, but daily cases is very essential for time series data. So that is why we go all out for these daily cases. So Twitter account is a good place to get information. Thank you.
All right, I believe that is a sufficient response to Frederick's question. I don't know whether we have any additional comments or questions on the same.
Also, my own question is on this institution. So I still don't know how to put institution here, although it's not compulsory. I'm just curious to know how to do that.
Mariam, the technical coordinator, I don't know if you can help out on this. I've tried to find out what we should have in here, which I didn't see in the scoping exercise, unless it has a different name or vocabulary.
Hi everyone. Can everyone hear me? Hello?
Oh, yes, yes.
Oh, sorry. Currently on the train, but so you just basically need to enter the institution URL link.
Institution URL.
Yes.
But it's not accepting it. Let me put it here.
Yeah, that's it.
Okay.
Oh, it doesn't show on there, but it can be accessed still. It on the interface it doesn't show, but that's okay.
Yeah. Okay. Thank you so much.
Yeah, Miriam. Hello, Miriam.
Yes.
Yes. Yes. Some of the questions that we posted here, like how do we link CRF to our FDP? Or to
Oh, for now, well, it's not really possible to do that. The wizard works with the FDP and the query interface and not with CEDA. So, but and also the fact that the bulk data upload or import import function was not considered during the development of the product. So as for now, it's not really possible to import bulky data. You just have to input it one by one. So, but a script can be developed, like Francisca said. So, but for now, you'd have to enter the data one by one, and linking the CEDA to the FDP is not really possible. That maybe you could, the only thing that is possible right now is putting the link via the FDP itself. You get, like, putting the link to the templates that have been populated on your fair data point, but still carrying out of queries would not be possible with that. So we're still trying to find a way around that. But for now, it's not possible. I hope that answers your question, Dr. Sakina.
Yes, you answered my question. Thank you. Yes.
No problem. Get to in the group chat says that you did not include the HTTPS on the FDP. It's supposed to be a full link. Sorry, I didn't see that. Could you try one more time?
Okay. HTTPS, all right. It's here already.
It's actually there. Okay, that's all right. No problem. Some of the things don't show. Even the license for some parts it doesn't show, but that's okay. It's still within the metadata, so it still gets found.
Other question is this. So what are we putting on that team? So are we doing it right by putting the link to that data set here?
So with the theme, it's something that should be related to the data set that you're uploading onto the FDP. Does that make sense? So in this case, you could put maybe the ontology theme. The ontology link on there, and then also the COVID-19 CRF WHO standards document link. So basically anything related to the data that you're posting is what you put on the theme.
Because I noticed that after putting those things there, so under the theme taxonomy here, so one will be able to see or download the data or anything you post there, as you can see.
No, you should. It wasn't like really okay. Well, it wasn't really right for you to put that there. That's not what you're supposed to put. So you're basically supposed to put links that are related. I'll send you a few links. Maybe after my class at around 5 p.m. If that's okay with you, we'll contact each other. You can send me a WhatsApp if that's all right. Yeah?
Okay.
Okay.
That's okay. Thank you so much.
Okay. No problem.
Yeah.
Okay, so I have put in 2 links in the chat box. There is one to a Google Doc and one to a GitHub. So we want to invite everyone to document their questions, their difficulties, and every other observations like this in this sheet and in the GitHub. And if for any reason you come across any of the documented difficulties and you have the answer, you've been able to figure it out, or you've been able to solve it on your team, you can always include that in the document as well. So it's a rolling document that will continue, and we will continue to work with. And also the guys from the Leiden University Medical Center, they have access to this as well. It was created by Eric during the last week's meeting. So it's a rolling document that will continue to populate, and hopefully we're going to from here have a documentation emerge from this project. So I will invite everyone to bookmark those 2 links, the one to the GitHub and then to the Google document.
All right. Any additional questions and comments? Yeah, I can see Ibrahim saying he looks forward to the new video uploads on the YouTube channel. We'll be sure to make sure all the videos from last week and this week are on the YouTube channel so you can make a reference to them going forward.
Yeah, thank you.
Final comments, going once.
Does that include from me as well, or the general comments from the House?
No, just from the participants. I see we have 22 individuals, so I'd like to give them a chance to ask a question or comment before we tie it up.
Okay.
Going once. Going twice. Yes, that's it. So I'd like to thank everyone for taking the time to be with us. I will now hand over to Francisca in case there are any announcements before we sign off.
Yeah, thank you, Charles. We'd also like to join you to thank everyone, especially Nate, who has been with us from the beginning. And each time we see him, it gives some kind of confidence that we still enjoy the support of our sponsors and our promoters. Just to also, I have an important announcement. Last week, Monday, Professor Miriam, Eric, and we had to go before a panel. Google.org and Google University Relations had advertised earlier in the year for some COVID-19 rapid fund, which we had submitted a proposal to. So we defended the proposal on Monday night, and the evening of Friday, the email was sent that we got a grant of $100,000 from Google for VODAN Africa. So this is an exciting news, and I wish to share this with everyone. So we'll be able to continue our projects, expanding in the countries where we already are, and possibly see if we can bring more countries on board, and the opportunity to also continue to develop the data stewardship, build curriculum and learning ontologies around all these topics, and carry on with the training of trainers in our various countries. So additionally, the VODAN in a box for Kenya, I thought you advertised, you announced this, Charles. It was installed in Kenya, which is really very exciting. And Zimbabwe also, Kudakwashes, I spoke with him shortly before we started this session, and he was going into a meeting with Director of ICT to get the URL for the VODAN in a box, the FDP for Zimbabwe. So we're hoping that by the end of this week or so, we should have the VODAN in a box installed and running in Zimbabwe as well. And with that, we would have gone around all the countries in the partnership and hoping to get more partners from each of these countries or have other countries join us. So I would like to thank you again, and hope to see you at the next installment of the M4M workshop. Thank you, Charles. And Ivy, thank you for bringing us together every week, making sure that we have speakers and something to talk about. Thank you.
Thank you, Francisca, for those comments. I believe that a recorded version of this webinar, as I had said earlier, will be available on the VODAN Africa website, as well as the YouTube channel, where we do have all the other videos, by the way. So in case you need to review all the previous webinars, whether it's the one on how to install an FDP, how to fill the CRF forms, briefs on the CEDA forms, etc. They are all available on the YouTube channel, so you can make a reference to those as well as other previous M4M webinars. So in case you missed part of this one as well, or you'd like to review it, just be sure to check out the YouTube channel. Also, be sure to join us for the next installment of the Metadata for Machines workshop. Details on the timings will be shared on the various VODAN Africa comms channels, whether it is Slack or the WhatsApp groups. So also be sure to look out for that one. And with that, I'd like to thank you all again for joining us today, and we hope we will see you next time.
Thank you. Bye-bye,
Thank you, everyone.
Bye, everybody.
Bye.
Yeah, thank you. Bye-bye.
Thank you. Bye.
Thank you.